Welcome, everyone, to Beauty and the Surgeon podcast. I'm Amy. I'm a nutritional therapy practitioner, and I'm joined today, as always, by my very olfactory-forward co-host.
Yes, sir.
Dr. Jason Martin. Yes, sir. Really?
Yes.
He's a board-certified plastic and reconstructive surgeon. Dr. Martin, how you doing?
Good. Is olfactory like a term that people know or no?
I don't think so.
Okay.
It means you can smell.
Yes.
It's your olfactory system.
Right. The olfactory system. Yeah.
Yes.
Do you remember the plate that goes between the nose and the brain? I always remember that one, the cribiform plate.
Cribiform. Yeah. So today we are talking more about rhinoplasties. We also did a great two-parter earlier in the summer. I feel like it was June. Was it June? May, June?
Yes.
May, June?
It was either June or January.
Right. Like, I'm not sure. Yes.
I had to think.
Yes. But it was a great breakdown two-parter where we talk about all things rhinoplasty. In this episode, I wanted to deep dive a little bit more because we do talk in that episode a lot about before I get into it, here are our social media handles. And if you're interested in just some of the things you wish you knew about a rhinoplasty, there'll be timestamps in the description box below as well.
I'll show it right here.
Yes. So with rhinoplasty, we talk a lot about kind of the mental side of it and some other things. But I really thought, like, man, what does somebody feel like they wish they would have known before their rhinoplasty?
Yeah. I feel like that's great for all surgeries, but especially for rhinoplasty.
Yep, I agree.
Yeah.
And so I did some that are a little more fun. And then toward the end, we're going to talk about the little bit deeper ones. And again, if you do want to see any of them specifically, just jump around the timestamps. It's totally fine. All right, Dr. Let's jump right in. Number one thing you wish you would have known, just how dry your mouth will be. Your lips and your nose may run all the time.
Yeah. It's more likely for a runny nose if you've had a septoplasty or they do something with the septum itself, just so you know. And that could be long term. But even without that, your nose will definitely run after surgery.
Because you can't sniff.
Yeah.
So it's just going to drip.
The dry lips Amy deals with, so I don't really deal with that as much.
Dry lips, dry mouth. I mean, it's like a baby with the first time they get sick. Oh, and their little lips get so dry and they're just crying all the time in their little mouth because they can't breathe through their nose. And,
I mean, when babies are sick, it's just so painful to watch.
It so sucks.
Yeah.
And they're just so unhappy. But it's, yes, you're going to be breathing through your mouth. And we are not natural mouth breathers. One of the things we did on a Stuff We're Into 1,000 years ago was
your lips together.
mouth taping.
And I still don't do it. And I think about it every night.
I mouth tape every night.
And then I was like, what tape does she use? Like, literally last month, I woke up in the middle of the night because I couldn't sleep. And I was like,
quarter-inch micropore.
Okay.
Mm-hmm.
I need to tape my lips together, and I could not remember what tape Amy uses.
Quarter-inch micropore.
This is what's going through my head at 2 a.m.
Well, if you had your mouth tape shut, you'd probably be asleep.
That's a good point.
So the reason your mouth is dry is because you're breathing through your mouth. So what are the cures for that? They make sprays for this, dry mouth sprays. They make mouthwash that's really nice. Just having lozenges or hard candies is really helpful.
Because that stimulates you to make more saliva, basically.
Yep. Keeps your mouth feeling a little bit less dry. Having a humidifier right by your bed when you sleep and just in your house in general. Saline spray, with a huge caveat, you are not allowed to spray it straight up your nose. You have to do it like you would with a baby. So you can kind of drip the saline in. Do not spray anything up your nose. And if you tell your doctor that you watched podcasts where they said you could use saline spray, I will deny it till I die. No, don't spray anything up your nose, but you can drip it.
Stick anything in there either.
No. Oh my gosh, yes.
It's not helpful.
No, it's not helpful.
Don't stick anything into anything after surgery.
Yeah,
unless you're told to. Yeah.
Lip balm and lots of Kleenex. And that's always the tough part too, like when somebody's nose is just dripping for a few days after surgery because it's dripping and there's like dried blood in there. So it looks like they're kind of dripping blood out of their nose. But just keep a little Kleenex, just real handy all the time and you'll be good. You got anything else on this one?
No. This is all you. It might hurt to chew. That's for sure.
Mm-hmm.
Yeah. You think about it. So your mid face, where your nose and your upper teeth are connected, they're not movable. It's actually your jawbone that hinges the mandible. But when you bite down on something that's sizable, that requires force, that force is going to transfer up to your nose. Mm-hmm. And you've, in many cases, had infractures or fracturing of the bone. So that's going to hurt. The second thing is the soft tissue is swollen. It's going to hurt. So any kind of movement of your mouth and lips are going to translate to some discomfort on your nose itself too. So those two, and just the swelling alone, any kind of eating process is going to hurt. So having blended foods or smoothies or soft diets, I mean, what do you say, Amy, for 3 to 4 days after rhinoplasty?
I tell people to plan on, just soft, gentle diet for a couple of days. You can, in most cases, eat whatever you would like, but doing some smoothies so you're getting all the nutrients.
I mean, you could pretty much blend everything, right? There's nothing you can't blend.
I mean, in theory.
With the new creamy, you can turn anything into soup.
Turn anything into ice cream, yes. Yes, soups are great. But also, it's frustrating. And again, I go back to a newborn baby who's sick for the first time. They're trying to breastfeed, and like they get a few sucks in and then they scream, because they can't breathe. So also, when you can't breathe through your nose and you're trying to chew something super chewy, you're going to be like gasping for air. So.
Right. It's going to affect your taste too, because that's directly correlated with your nose also. So
yeah. And the inflammation. So food might taste kind of bland and it might hurt to chew. And that's something I think most people probably don't think about before surgery. And then it's happening.
I didn't think about that with nose jobs. So after one of my many nose injuries, I bit into a piece of fruit and it felt like
shooting through your brain.
Like your nose was going to explode.
Yes, I had.
And I know you made this point, but I want to make this point again. It was not an elective surgery. You did not have a rhinoplasty.
Not
you
at
broke
all.
your nose like 100 times.
I was just thinking, well, it's my mouth. Why would it hurt? And then, oh my gosh, it was like an apple or something. It was, miserable.
Yep. Yeah. All right. In amongst that same vein, drinking through straws and carbonated beverages might also hurt. And the drinking through straws is because you have to create that suction, that siphon.
Which is a big movement of your facial mimetic muscles, yeah.
It's like that's going to hurt. And the bubbles can almost feel like they're doing something on the inside. Like it's hard to even describe that to people, but like...
I don't know about that one, but you're talking to these people more than I am.
Yeah, that like bubbles feel hot or spicy. Yep, that they feel like they're stingy. So
I could see that.
Sippy cups. There's some great ones, the big 40-ounce tumblers are super popular with everybody, but there is a good one from Awala that it actually can sip out of, so you don't have to drink out of the straw.
So it has like a baby sippy cup on 40 ounces?
Yep, it is. It's a 40-ounce baby sippy cup.
Like something you would take to Vegas or something.
My favorite.
Element, LMNT.
Yep, the non-carbonated ones. That's what Nils rocking the Element, stay salty. Yeah. And flat things, like do ginger ale, but just let it sit and get flat for a day before surgery.
Yeah.
Yeah, because it does taste, if you want that taste.
I guess ginger ale is more flat than some of the other ones, but it's still carbonated, right?
It is, but it goes flat really fast.
Yeah, I got you.
It gets flat easily. Yeah. So those are my tips. And, they'll give you that big straw cup at the hospital, but have some cups that are easy to drink out of that also are not going to bang into your nose.
So is the reason they give ginger ale like medical places because it has an anti-nausea quality? Yeah. Okay, so is that the ginger?
It's the ginger. Oh, ginger is, oh my gosh. Well, you are not a person who suffers from motion sickness. I will tell you this ginger is very, very, very key. Yeah, ginger tea settles the stomach.
I don't get like car sickness. I do get a little bit of vertigo on those rides.
That's different. Yeah. But yeah, ginger is amazing for morning sickness, for postoperative nausea. Okay. Yeah, ginger is key. All right.
Oh, yeah. So you've had a rhinoplasty and it's awesome. You're still swollen.
You got to say what it is.
Well, you're going to have to sleep upright because of the swelling.
Semi-upright.
Yeah. I guess you're not standing. You're not standing.
Yeah. You're in a reclined position. Yeah. Like a horse.
Don't ever sit down.
Cow tipping out there.
So it's like 30 degrees and that's at least 2 pillows, sometimes 3. You're not going to want to sleep on your sides, even though you probably could. It's going to hurt. That's going to feel weird and uncomfortable. So that's tough. That's not easy. And how long do they usually sleep in that position, Amy?
At least the first 2 weeks. And I don't want someone sleeping on their side. So you do need to sleep on your back for 4 weeks.
4 weeks? Oh, yeah. 4 weeks total on your back. That could be really difficult.
Yeah.
Now, what about like kind of over 25%, 30%?
So I do have some good tips for this. So what I call this one was sleeping semi-upright sucks, because it does. And in theory, you're like, oh, it's not so bad. Like I've slept in a chair before. Like that's fine. It'll be fine. It really sucks. But there are things you can do to make it suck a lot less. The supportive pillow system I recommend all the time. Highly recommend. Because it can really keep you very supported. If you have a recliner, especially for the first few nights, it's really nice. Recliner kind of keeps you forced in that position. The other one, pillows under your arms, so that when you're laying on your back, people end up just laying there and then their arms are just like flayed out to the side, like their mouths dropped open.
So the pillows under your arms would be like your arms over your chest and pillows underneath?
Yeah, like right at your waist level.
Okay.
Like just to support underneath them so that they're not dropping and your hands aren't falling asleep in the night.
What is a pillow under the chin?
So this one is the best tip ever. So what you need to get.
Such a sensei. Like all this stuff is going on. I know nothing about this.
Yeah, so it's not like a neck pillow. That's not what I mean.
It's not like one of those flying pillows?
No, because those are, as we all know, those kind of suck too. I mean, those are not great. If you get a small Squishmallow or something that's about that size, so you want the Squishmallow that's like the 8-inch Squishmallow. And I literally have our patients buy Squishmallows. I send them the link and they buy them. I'm like, give it away when you're done. Like, give it to Goodwill. because of the shape and also the softness of it, you're able to put it like right here under your neck. If you're not watching us on YouTube, you should be. And then what you can do is you can kind of lean your head to the side like this. So you feel like you're on your side because your ear's touching the pillow, but your nose is nowhere near it.
Why don't I bring that on one of my trips? I mean, that would be
they're the best.
Yeah.
Like, I mean, honestly, like it is amazing.
Yeah.
Like they're, again, they're inexpensive to purchase, and you can either gift it to your child or give it away at the end if you don't need to keep it, unless you have something like that in your house. But there's just something about the texture of the Squishmallow that is so supportive, but also so soft. And it's easy to switch side to side.
We could start a Rhinoplasty philanthropy and have everyone send in their Squishmallows. Is that what it's called? Squishmallow?
It's called a Squishmallow. Oh, and then you pass it on. I mean, I honestly wish that we could have a Squishmallow made that was a nose. But they're great. I mean, that's why our patients do after facelifts too, because you really, I mean, after a facelift, you don't really want your ear.
Why don't we put our
touching
logo
the
on a
pillow.
Squishmallow?
Yeah.
Screw the toilet extender.
Yeah. But it allows you to stay feeling like you're kind of on your side.
Yeah.
It also keeps your chin up, so that because you're breathing through your mouth, it's keeping you from
So it's just
yourself.
just real quick, it's a square, but it's not wrapped around your neck.
No, they're round. They're round.
They're round. Okay.
They're Squishmallow, Oh,
You keep saying this word like Nils and I have like 4 of them at home.
Squishmallow.
Right here.
Right there. They come in many characters. You can choose.
It's not helping me because you're going to edit that into the...
Yeah, you won't know
you won't
for
know.
a couple of weeks.
So I watched the show.
They're like you've seen them at even Costco. Costco sells huge ones. I mean, it's like a body-sized Squishmallow, but they're like a little animal or they're a fruit. Sometimes they're pieces of fruit. It's like an avocado or it's a flamingo. You pick whichever one suits your vibe.
My Squishmallow is going to be your face. Okay?
I mean, that would be kind of awesome.
Kind of snuggle up against it at nighttime.
Yep, the big hair.
Yeah.
My Squishmallow would be.
And you're going to have your Sally Jesse Raphael glasses.
Oh, that'd be awesome.
Yeah, your pink ones.
Yeah, but those things really help. It kind of just tricks your brain, and it makes the sleeping upright
Squishmallow
suck a little less.
Yeah.
Still sucks, but sucks a little less. Sleeping in general might also be tough, though, is my next one.
Yeah.
And managing your dry mouth is going to be key. Getting in a comfortable position. And then if you need it, sleep is important after surgery. If you need a little bit of Tylenol PM or a little bit of melatonin.
Benadryl, something
Benadryl,
like that.
Don't be afraid. Talk to your doctor about it first. But I mean, even in, people who really struggle, if they just haven't slept for a couple of nights, even a prescription for a few days, if they need it to get through that hump.
What do we usually give? Not Lunesta. We use
Ambien.
Ambien.
Yeah. If you need to, you need to sleep to recover.
Yeah.
So,
I mean, we've had talked tons about sleep with REM sleep and deep sleep and how that can help with your mood and also with healing and inflammation. But just the stress of not sleeping with the stress of pain can make the pain feel worse. Mm-hmm. And that's, I think, the big part of it too. A short-term sleep loss is not going to be so problematic, but really what it does to your feeling of pain and discomfort.
Yeah, it just makes everything worse. Just not sleeping makes everything worse. So if you're not sleeping well, talk to your doctor and see what they recommend. But there are solutions for all of these things. And get a Squishmallow. All right.
All right.
We're going to take a quick break. We're going to come back and talk about some of the deeper stuff.
I'm going to go Google Squishmallows.
Your kids were just in the wrong... Your kids are old enough that they didn't have Squishmallows.
I know. There was no Squishmallows.
No Squishmallows in your world.
Maybe we just missed it.
We're back. Now we're going to talk about the deeper side of this. What are the more emotional things you wish you'd known? We talked about the physical things that you wish you would have known. Dry mouth, hurts to eat, maybe not spicy food or bubbly beverages. I was going to say spicy beverages. One more thing about kind of the skin. Very common for people to complain of having skin changes, specifically clogged pores on their nose.
Like comedones and things like that? Is that what you're talking about?
Or their pores just look enlarged.
Yeah.
And a lot of that is because you haven't really been washing, right? It hurts. So you're not scrubbing at your nose because we've told you not to. And that just kind of builds up. Those pores can get a little enlarged. They're a little bit clogged. I love just a simple alpha hydroxy wipe or potentially some topical salicylic acid. Great options. Clear with your doctor before you start using it because you don't want to put anything over the incision if you have one, but it's really common and it will normalize, or your skin just might look really oily. When that skin is stretched too from inflammation, it'll make the pores look bigger because they're all stretched out. So
and it just doesn't work right because it's so swollen.
Yeah, it has trouble with the sebum.
Exactly.
Yeah.
So
that all goes back to normal though, but do expect that.
Just out of curiosity, these wipes, where do you get these wipes? Is this over the counter? Or is
over the counter. Just a little alpha hydroxy wipes. really common. I mean, you can get Ulta, Amazon.
Okay.
Yep. Or a little salicylic acid. I actually really like the one from The Ordinary. It's like $6. It's really inexpensive and it's a liquid. So it's not like a cream. So it's really gentle and it's just going to help clear out that pore. Just gets in there, gets that oil out.
Nice.
Yeah, really simple. Or just give it some time. And that's what I tell people too. As soon as you're, a month or so after surgery, when you can really kind of, gently wash a little bit more, it goes away. And so does with the inflammation. But it's...
Yeah, about 10 days, the noses aren't looking so great in the skin. And you're like, oh, we need to wash it. Yeah, okay.
Which is why the next slide exists.
Right.
I'll let you read this one.
The big reveal may be disappointing. All the shows you watch where they do the big reveal, it's 100% BS because they're usually showing you 4 weeks afterwards.
Oh, at least.
Rarely do you take the splint off or the dressings off and everything look 100% normal, even with a closed rhinoplasty, something that's less invasive. Yeah. The nose swells. I mean, it's a small space that's contained. And you do any kind of work on it, it's going to swell, just like a fingertip in your mind. So there will be swelling, and that swelling will persist. So you're not going to, if you have a large or thicker nose or bigger nose, it's going to look better, but you're not going to have your final result. And that's always a little bit disappointing to people. You're not going to have your final result right away.
Yep. And the splint itself, kind of forces inflammation down into the tip.
Yeah.
So
you take so a lot of people have tip problems.
Yes.
And you take the splint off and they look at their tip like, what the hell? My tip is bigger.
Right. I look like Gonzo.
Yeah.
No one knows
that goes away within a couple days. It gets better within a couple days.
Oh, even within a few hours of taking the splint off, it just takes some of that pressure off and allows it to it's like taking a garment off after lipo. Like it allows that inflammation to kind of redistribute a little bit.
Totally.
But you take it off and your nose, again, your pores look kind of clogged. Your nose looks really greasy. Like it's not like this glamorous big reveal. Just swelling, you might be bruised. So yeah, we take the splint off, but you still got black eyes. Like it's... Yeah.
The one thing that's really notable when you take off the splint, because the splint, the profile, because the splint's providing compression. And so the profile is where you see the big change. So a lot of times we'll take pictures and show them that. That sure makes people feel better when they don't have that big bump in their nose anymore.
Well, and we see the change, but it's hard for someone else to see through the swelling.
I can't stop looking over at Nils's profile when we're doing this.
Oh, he's got a nice nose.
Well, he needs a little work there.
As long as he can breathe.
Yeah.
All right. It works. So now we're getting to the stuff that's a little bit more weird proprioception wise. In this common, your nose may feel like it's not moving with your face or when you smile. Yeah. And this can really start to weird people out.
I've never heard a patient say this.
Yeah.
Is this a common thing?
Yeah.
Okay.
That they feel like their nose isn't moving. Like if they're looking at themselves, like if they, if they're talking to someone on FaceTime and like they just feel like their face doesn't move just correctly. And it's because you're swollen and areas are still numb.
You actually have muscles around your nose that actually move your tip. There's a depressor muscle for the tip that brings it down when you talk. It kind of pulls the tip down. And those muscles, even if they move when you're swollen, it's not going to move the tip down. There's too much tension there. So
yeah, and same thing when you smile, like the edges of your nose kind of lift.
The nasalis muscles, which are injected with Botox, those will change the way the sides and even the dorsum or the profile of your nose look. And those aren't going to work normally when you're swollen. It's not going to happen. So you're just going to have this big monolithic nose sitting there that doesn't move when you talk.
For a little while. And the ways to manage that are things like arnica, bromelain I love for inflammation, icing, and
the tincture of time. The tincture of time.
Yep. And it's not as much time.
How many
as
times has Amy said the tincture of time? Time.
It's time.
Time after time.
Mm-hmm. It's all time. So that will get better, but it does kind of weird people out. And especially because we do spend so much time looking at ourselves, especially with it's your nose, you see it all the time. And this becomes some of the issues that we get into when we get deeper into the things with rhinoplasty.
We're going really far down the rabbit hole right now. This is Alice in the Wonderland.
Yes.
Okay. Through the looking glass.
Not everyone will be supportive of your choice to have surgery.
Nope.
And if you go back and listen to the episode we did about rhinoplasty, we talk about the unfortunate story of Jennifer Grey. Famous actress, had a rhinoplasty, completely changed her look. She basically never worked again. And she felt pressured into having a rhinoplasty.
By her mom, which is devastating, actually.
Yeah, she thought she'd get more work, and it turned out she got less. But there are a lot of people in your life who are going to judge you for having surgery. You find out who your friends are real fast and who your frenemies are. And also your family who wants you to, quote unquote, love yourself is going to try and dissuade you from doing this. And then when you choose to, they may say things that are not that positive about it. That you don't look like yourself, that you look different, that you change something. And that can be hard. So if you know that those people are in your life, you need to find your tribe. And whether that's in person, if it's in your doctor's office, or if it's online, like there's some great supportive communities out there. Now there's some also really toxic stuff online. But, you deserve to have the surgery you want.
Right.
Like timing your social interactions is another one I put on here. Don't bring all your frenemies with you to your splint removal. Like, don't do that. Maybe don't FaceTime your grandma the day after surgery. You got black eyes and she's judging you for changing your nose.
Bring your grandmother that complains about everything
right.
to your split removal.
Yeah. But, those are things that you can manage, who you interact with, the timing of those interactions after surgery, balancing the expectations of people in your life. You're like, yeah, I know I'm going to be swollen. I know I'm going to be bruised. But it's tough. Like when you're recovering and you've got people in your life who are not supportive of your choice and are really kind of trying to drag you down or being judgy. Like, do you regret this? Oh, you still got a black eye. I bet you regret doing this. Comments like that, not helpful. But you might find that there are people in your life who say things like that, and knowing who those people are before surgery,
it'd be very helpful.
Very helpful.
Because if you go to a board certified expert, an ENT or plastic surgeon, preferably a plastic surgeon, and they do a natural rhinoplasty, you're going to love your results. You're going to look amazing, right? If you go to someone who's competent, but you have a period where you don't look normal, right? So why would you put yourself around people that are just going to be critical to begin with?
Yep.
You could love them. You can be friends with them. They could be close to you, but just surround yourself with people that naturally are positive and supportive, because you need 4, 6, 8, even 10 weeks to sometimes get through the swelling to where your nose really does look good. Yeah. And up to 6 months to a year sometimes for all the swelling to go away. So there's going to be that transition time that you have to plan for.
Yeah. But managing it in advance and really mentally preparing yourself for that, because you may think you are, but man, when those things start happening, when those people start saying those things, like that's when you need to have a plan ahead of time of what you're going to do in those situations. Like, how do I get myself gracefully out of this situation when it presents itself?
I tell you how I would do it, but it's probably not going to end well. So
it is not graceful.
That's where the alpha part comes out of me. I'm just like, all right, so you have a problem with my nose, you son of a bitch. That doesn't always go over well.
No. All right. So here's the other thing we learned.
Changing your appearance. This is like the other end of that spectrum. Won't change the way people treat you.
Yep. If you thought you weren't getting dates before because of your nose, chances are you're still not going to get dates.
Right. The nose is one of my interests. I love doing the surgery. I love the transformation. It's very bespoke and intimate and subtle. And it's about the minutia. It's about the millimeters. And that's my love language. That's my ethos. Amy and I love those surgeries. We love those patients. I always try to hit the Goldilocks area. And the nose is right there, so you see it. But in reality, people look at you as a gestalt. They're not staring at your nose, even if your nose is super large, super asymmetric, or whatever it is. So if you change that, it's going to change the balance of your face. You're going to look most likely better, but it's not going to be a drastic change in the mind of other people. You may see it, but other people might not see it.
Well, just in general, even if they see it, they're not going to treat you any differently because of it.
Right. And that's the second part of it. Most people don't treat you a certain way because of the way you look. I mean, these are basic tenets, but that's not the way it works. You may feel more confident. This may project onto the world that there may be positive butterfly effects that come from that. But in reality, the way that people perceive you is not going to be drastically changed if your nose looks different. Now, if you're traumatized, if you have definitive deficiencies, totally different. If you have something that's truly abnormal from an injury or birth, that's a totally different story. But the minutiae,
even then, people shouldn't treat you differently because of that.
Okay, well, that's the layered part.
Yeah,
and I'm just talking about the pragmatic realism of this. Whatever you think that people are thinking, they're not thinking because they're not even thinking about you or how you look. They're thinking about themselves and what they're going to say next to you or something. So I think that you do this for yourself. You do this for the benefit of your self-perception, feeling empowered, et cetera, et cetera. But yeah, people are not going to, I mean, we hear this all the time in our clinic, by the way.
I mean, unless you're Jennifer Grey.
Yeah. Well, that's different. I mean, she's high profile.
Yeah.
And also her face kind of defined her notoriety.
Yep.
Right. So that's totally different. That's not a normal person.
Nope.
So.
Yeah. So the two truths, or the one main truth, I think people with any surgery, not just facial surgery, is that the way we see ourselves is not how other people see us.
That's what I was trying to get.
Yeah.
Thank you.
And we see this with patients who perseverate on one thing, and we address that. Let's say it's a little bit of fat that they don't like on their knee. Well, then that's gone. Well, now they really hate the fat near their elbow. I mean,
happens all the time.
You
think we would be happy about that because it's recurring business, but it's like you have to kind of bring people aside and say, okay,
we're our own worst critic.
Yeah.
You're always going to find something, but it's not something anybody else cares about or sees.
Yeah.
And at the end of your life, did it really make a difference?
No.
So like Dr. Warren said, do your surgery. Like you deserve it. Yeah. Ooh, this is the big one. You might regret having surgery.
Especially,
sometimes.
Yeah, sometimes with rhinoplasty. This is the big problem with rhinoplasty, actually. And the people don't talk about it, right? Because it's all about sales and pumping out all these positive things. But rhinoplasty has a small percentage where people regret it, even if the surgery is good. And that's because the nose, and we've been fortunate in our careers to not really have that patient. Some of it may be that we do a natural rhinoplasty that stays within a normal range, but man, I mean, that Jennifer Gray story is a perfect example of this.
Yeah.
Right.
And if you do look online, I mean, you will find many like Reddit threads where people talk about how mentally challenging it was after their recovery from rhinoplasty. It's surprising. You don't find that with other surgeries as much. You do a little bit with like mommy makeovers, especially moms with like young kids still. They start to feel a lot of regret and like, because they aren't able to help their family. Like there's a lot of other multi-layered things, but this is different. Like recovery is mentally challenging, even when you're excited to have surgery. It just is. And especially when it's something on your face that you can't stop looking at because it's right in front of you all the time. Literally. Your face may not look like yourself or how you expected. And we have some great episodes where we talk about expectations for several months. And that little itty bit of that doubt just builds and builds and builds. And that's why I put you might regret having surgery sometimes. Like sometimes you might be like, man, why did I do this? And other times you might feel great about it. And that's normal. Like it takes time to get used to your new reflection in the mirror. It's a big, it can be a big change. Even when it's a subtle natural change, it can feel so big. Like
you see this with breast augmentation too, actually.
Yeah.
Sometimes they have buyer's remorse.
Oh, absolutely.
Yeah.
Because it doesn't change how people treat them and they wanted it to.
Right.
Yes. So this is 100% normal, but knowing that you might feel this way after surgery is going to help you, and knowing that this is normal. Like with any surgery, I mean, I don't know that there is a single surgery we do where someone, 2 days after surgery who's in pain hasn't said to me like, oh, why did I do this? Like every surgery we do, every single one, even something as simple as like an upper lid blepharoplasty where somebody's bruised and they're like, oh, I shouldn't have done this. And I'm like, because you have a little baby bruise, like you're going to get over this feeling. And I'm not trying to downplay their feelings in any way, but it just, we blow stuff up in our minds when we're in pain or stressed. Your body doesn't know.
Tough love definitely helps in the recovery period sometimes.
It does when it comes from you.
Really? Not from you?
No, well, it's not my vibe. I mean, there are times when I do, and there are times when I have to. But
I definitely do the tough love thing.
Yeah.
But it's always compassionate.
Yeah.
Like I just, I'll start out the comment by, look, I am with you and we care, but X, Y, and Z.
Yeah.
Like you need to get
pull yourself up.
Pull yourself up. Let's go. Yeah.
Yeah. But I think that's the bigger part of this is especially with a facial surgery. And these tend to be on, as we looked at our statistics, on a younger population, it's a little bit different. You do a facelift on somebody who's 65, like they're just so excited to look better and to look like themselves again. They're just, ecstatic. Whereas someone who's 25 and has really put so much pressure on themselves to have this surgery, and then you look a little weird and you're bruised and you're swollen, like, oh gosh, why did I do this? Like, am I going to regret this? Like, I shouldn't have done this. I should have,
Totally.
Those feelings really get to you. And this is where having a supportive community becomes very, very key. And that's why I put that slide before this one, because those are also things that you need to know. Like, you got to make sure the people around you after surgery have got your back. If they don't, you're aware of those people who probably don't and probably won't, and that you need to, get those energy vampires at a distance until you're really mentally good with it too.
Or do what I do. Just don't associate with anyone. That's good.
Oh, yeah. There's that too.
Yeah.
That is probably not going to help the mental challenges of recovery.
I don't appreciate the energy vampires.
No.
I struggle with those kind of people.
Yeah.
So I only keep people around me that truly got my back, are loyal to me, and I'm loyal to them, and will accept my faults and I accept their faults. And we joke about it openly, and we don't self-aggrandize. We don't build each other up. Amy and I are like this. We openly say we are deficient here.
I am so dyslexic.
Yeah, right. We say that.
Logic.
Right. And that's the people you need around you, I think. I mean, that's my opinion. But.
Yes. In a perfect world, we'd all be surrounded by only people like that. But in the real world, energy vampires exist, and sometimes they're related to you.
Yeah. Nils is not an energy vampire.
No, Nils is the best.
Nils is like the opposite of that. Sarah's not.
So is there anything else, Dr. Warren, that you think a person should know before rhinoplasty?
No, I mean, I think this is an amazing surgery. It's very niche. It's not everybody wants a rhinoplasty, but I mean, hopefully people find their way to this video and they see, okay, there's some things I need to consider here that are probably above and beyond what my doctor told me.
Yeah, go back and listen to our first 2 parts, or part 1 and 2 of everything you need to know about rhinoplasty.
It's definitely a more mental surgery, which is why I love it. You could see it. It really is adjunctive to your face. There's not many things like that either. So, and it's so small and so nuanced. Sometimes it's hard to put words to how you feel afterwards when you're swollen. This looks different or that looks different. It's hard for people to even put words to how they feel about their nose when they come in for the first time. They're like, I'm not really sure. And then you drill it down. Oh, you don't like your tip or you don't like your profile. So I think that these are really important for you to understand if you're going to do this surgery. The support stuff afterwards, I think is true for any surgery, but especially for facial surgery. We've had patients who had amazing results, like for a facelift, and someone close to them said, "You don't look like yourself." Or you 7
look
days.
the same.
Or at 7 days. Yeah. And I was like, that's so insidious, that comment. Like, why would you say that? And you wonder, like, what is the motivation for someone to say something like that? Maybe they weren't thinking. They just said a comment. Maybe they're jealous because you had the surgery and they didn't.
Yep.
Maybe they want the same surgery and they're pissed because they can't afford it. Maybe they just are not a good person.
They just come from a negative headspace.
Yeah. And maybe they're not happy with themselves. So I think the support thing is kind of huge. I'm really happy. This is actually a very good episode.
Yeah.
We should do more of these because I think these are the things that really make the difference for people to empower themselves and educate themselves for surgery. And these are things you're never going to get when you go into a doctor's office because they're not going to spend the time with you, right? They're not going to sit down for 20 minutes or 45 minutes and say, hey, let's talk about, family support, friend support. They're not going to do that.
Nope. No. So thank you everyone so much. I would really appreciate it personally, and all of us would appreciate it if you would share this video with a friend. Also subscribe if you haven't. We would really appreciate that as well. If you'd like to send me a voicemail or a text, you can do that at 303-630-9038.
She still has to read it.
Every time, because I am dyslexic. And even when I read it.
She remembers phone numbers.
Oh, I know the phone number, but I still look.
Yeah.
Because all those 6, there's a lot of 3s. There's the 6, the 9. There's a lot of things. 303-630-9038. I love voicemails. I love texts. So please shoot those over. And also you can find links to the other podcasts we referenced in this article or in this podcast down below, along with the timestamps. And we will see you here next time.
See you later.